Hello, Ani Buju. Benasfe Animikwam Indigenous Moganakusingo Down in Down in Kidodum. My name is Frank Animikwam, and I'm from the Little Traverse Bay Band of Odawa Indians in Petoskey Harbor Springs, Michigan area. And my clan is the Thunder Clan. And I'm also a doctor in family medicine training at the Sparrow MSU Family Medicine Residency program. And I'd like to talk with you today about integration of family medicine and traditional healing practices of Native Americans in Michigan. So a little bit of background and a little introduction. Native Americans have some of the highest rates of healthcare disparities in chronic health conditions, despite being roughly 1% of the population in the US. Little is known about the level of integration of Native American and traditional healing with family medicine in Native American communities in Michigan, and if there's a difference among health outcomes. And this study was not an exploration of different types of traditional healing practices. They're diverse and they are rooted in spirituality as well as plant-based medicines, making teas, salves, as well as prayer and ceremony, notably smudging with herbs or using a sweat lodge. This study was to explore, does a difference exist between perceived health outcomes of Native Americans in Michigan who use Western medicine, traditional healing, or a combination of the two? So the logos here are to represent the three partnering clinics, the Little Traverse Bay Band of Odawa Indians, Pokagon Band of Potawatomi Indians, and the American Indian Health and Family Services in Southwest Detroit. The methods that we used was a community engaged, respectful approach where we contacted these clinics and had approval from them to do a quantitative and qualitative study. The quantitative aspect used anonymous patient surveys that were distributed by and collected by the clinics themselves, then were mailed to researchers. And the qualitative was interviewing key informants or colleagues, as I like to call them. And they were Native American doctors, family medicine physicians, and as well as traditional healers at each of the clinic sites. The time frame of this research took about 1 year. And we were IRB approved from the Michigan State University. So if you scan the QR code there, you can see a PowerPoint, as I won't get into all the details there, of our methods approach. And the quantitative, there's a survey that we developed by us, the researchers, and it's in there for your review. And the qualitative study questions for the interviews were adapted from that survey. And the patients who took the survey, as well as the doctors and traditional healers who were interviewed, were asked that same line of questioning with regards to, did they perceive a difference in their personal health or the health of their patients for those who use Western medicine, traditional healing, or both. The results here were pretty intriguing. The findings for the quantitative studies, the survey showed there was a positive relationship between using traditional healing and self-assessed health with a pretty strong p-value. Significant difference in perceived health comparing those who used the health center or both services. And there was a comparison to those who used neither. And of note, those who used both compared to neither had a pretty significant outcome here. For the qualitative, the interviewees shared similar experiences that their patients who used both services had better perceived health as well. And you could scan that QR code to get further into the results, especially with regards to what analysis approach was used in SPSS by a research advisor, Dr. Phillips. And we used a deduce as well as a coding index that we developed for the qualitative research. And that allowed us to see what themes we were able to pull from the discussions in the interviews. Now for limitations, they included it was a broad research question, so it might help to focus in the future. There was no comparison group, so it might be interesting to look at Native American communities compared to non-Native American communities to see if there's more of a difference that exists. And opportunities for future studies are, future partnering and collaboration with Native American communities in Michigan who are represent an underserved community, as well as with regards to research as well as underrepresentation and respectful community engaged research done with Native American communities. And it'd be interesting to explore the health belief system and to be able to provide better care, and to also see if there's a more respectful way to approach researching traditional healing as to respect the sacredness aspect of it. So conclusions here: a difference does exist between perceived health outcomes among those who use Western medicine, traditional healing, or a combination of the two. Those who used both had higher perceived health compared to those who did neither. And then again, supported by our quantitative and qualitative data. Thank you so much for your time, and I hope you enjoyed this presentation.